All right, let's do an assessment. Okay, so first off, we're going to examine your head. Do you have a sit up for me? All right, so to inspect and palpate your scalp, we're looking for any lesions. Is there any tenderness as I touch?
No.
Okay. Let's see here, what else? We want to palpate our temporal arteries. Anything going on there? No tenderness? Okay, and we're going to palpate the mandibular jaw. Can you open your mouth and shut? You feel any sort of grinding in there? That feels pretty good. All right. Pull your mask down for me. I'm just going to take a look at your symmetry of your face. Can you smile for me? Okay. Good. That looks good. All right. Now, eyes. So, external eyes. We'll just look around in here. Check the conjunctiva and the sclera. Looking for any discolorations, signs of inflammation, etc. You wear contacts, I can see. Look the other way for me. Alright, good. Now let's also check. I want to take this little fork here and I want you to follow it with just your eyes. So we're testing your oculomusculars, all that good stuff there. Yeah, nice, that looks good. And we are going to check. If you look straight ahead of me, I'm going to check your perla. This is for accommodation, reaction to light. Woo! Yes, indeed. It's nice and brisk. It's pretty bright, huh? Look at it. All right. Visual fields. Tell me when this one comes in. You already saw it?
Yeah.
You have that good of peripheral?
Yeah.
That's amazing. All right. I need that kind of peripheral vision. All right. So let's check your ears out. Inspect and palpate around the outer ear first. Any tenderness? Auricular region. Nice set of earrings you've got there. Alright, now we are going to have a listen. I want you to, this is called a Ren's test. I think it's Ren. It's either Ren or Ryan. And so this one, we're going to smack this fork and I'm going to hold it to the back of your ear here. And you're going to tell me when the sound disappears. Discussed earlier, that is the C note. You should be able to harmonize that with the note G. So that's still going pretty good, huh? Need you going. Let's try the other side. Takes a little more while. All right, this one's the Weber test. Same thing on the forehead. It's just like the snow. You got good hearing. Is it gravitating to one side or the other? Good. Now we're going to inspect that nose. You can pull your mask down. Look inside there for anything. I'll take a little nose inspector up in there. No boogers. Any soreness inside the nose as we touch and palpate around?
No.
You ever had a broken nose before?
No.
Neither, I can tell. But you have not. It's nice and straight. All right. So I'm going to check your sniffer. All right. So pull the mask down and close your eyes and tell me what that smell is. Alcohol. It is indeed alcohol. All right. So let's take a look at your mouth. I'm going to inspect and palpate around the mouth, and I've also got a tongue depressor, so we can look around in there. Open your mouth. Any soreness about the lips? No? All right, the mucosa looks nice in there. So, tongue out. Yeah, good stuff. Take your tongue and push against this. One of our push on that side. All right. Excellent. Now we also want to take a look at the floor of the mouth. Raise your hands up. Let's look at the top. That looks wonderful. Okay. Inspecting the gums and the teeth, those all look great. Very white. Okay, now we're going to check your neck out. Pick your mask up for that. All right, so tilt your head back a little bit. I'm looking at your trachea area here, and I'm also looking for any signs of a goiter around the thyroid gland. And then we're also going to take a look at, can you turn your head to the left? Now turn to the right. Push down on your shoulders, you shrug up. Beautiful. All right. Now let's take a look at your nodes. So got some lymph nodes up in here. Let me know if you feel any tenderness, okay? Go to the back side. The nodes. I don't even feel any nodes. That must mean you have no inflammation there, huh? Down this way. There's also some nodes about this area here. Anything? Wonderful. All right. Strength of the neck. Go ahead and turn your head. Just put pull against that. Feels pretty good. Let's try this side. Yes, indeed. We got hair on my here. All right. So all that looks pretty good. We'll palpate the thyroid gland. I didn't feel anything going on there. So any tenderness or soreness about that neck area. Okay. Now, let's do the chest and the lungs. Just like we did earlier. As I move my stethoscope, take a nice deep breath for me. Okay, here we go. Let's do my stethoscope. Okay, I'm going to go around to the other side, same thing. As I move my stethoscope, take a nice deep breath for me and go. Very clear. More. All right. Now we'll take my stethoscope here. Let's see, what's next on the list? Auscultation of all the fields, we did that. One thing I wanted to check is expansion. So as you take a deep breath, I'm going to take my hands and put them on your back. And we can tell expansion by how far my fingers, my thumbs go apart. So go ahead and take a big deep breath. Nice. Try again. So we're looking for symmetry here, and it's nice and symmetrical. There we go. All right, so on to the neck and vessels. All right, tilt your head back and turn your head to the left, and I'm looking for any jugular vein distension over here, and on the other side, make your turn over there, distension there. So the next thing we're going to look at is palpate your pulses, one at a time. Carotid pulse there. Stuff. Alright. And inspecting the interior chest. Good. I don't see anything there. Palpating apical pulse, apical impulse. I don't know how to do that. A skull tape, all heart valves. I don't know if I've ever done this with stuff. Nobody hear what I'm saying. With the bell and the diaphragm. So let's check out the heart with the bell, and we're going to listen to the carotid for the bruits. A nice swooshing sound in there. Good. All right, next up is the abdomen. We'll go ahead and lay down. So, we're supposed to inspect the contour of the abdomen. You'll need to pull your shirt up for that. Let's just do symmetry. So I'll place both hands on the side. Feel in for any discomfort. Nothing there? Okay. All right. Listen to the quadrants. All right, here we go. All four quadrants. Now, light palpation, we've already done that. Also take the bowel sounds. Skin looks good. And we want to look for a pulsation, the aortic pulsation. And I can see that through your shirt right there. I've got a nice pulse there. Wonderful. Laughing. Examination of upper and lower GI. Okay, go ahead and have a sit up. And hold your arms out straight in front of you. And close your eyes. And I'm looking for a drift. So some patients will have a drift in their arms. And that looks pretty good. Okay, relax. Let's also take a look at these. You have nail polish on, so I can't really see, but I think they're okay. Take your arms up, and I'm going to feel for your elbows. You can move this one down. Okay, move your elbow back and forth. We're going to feel for some crunchiness going on in there. Nothing at all. Any pain in your shoulders when you shrug? Go like that. Wave your arms around like you just don't care. Fingers. No pain in the fingers. Okay, now go ahead and lay back down. We're going to check the legs. And we're looking for any edema in the legs. Right away I can tell that you do not have any edema in the legs. Good skin turgor on both sides. Pulses are nice. Let's check that skin turgor on those hands again. Yep. Nice. That looks good. Okay, capillary refill we did. We're checking capillary refill here. I'm sure those are done up too. So we're not seeing anything there. All right, let's move on. Oh, are you warm? Yes, you're not cool to the touch. Nice. Okay. Now, musculoskeletal. So let's inspect and palpate the musculoskeletal. All right, go ahead and sit up again. Good times. We'll test all your joints like we already was doing there for a little bit. Wrists, any pain? Ankles, any pain? Can you dorsiflex and plantar flex? Nice, no pain at all. Do that again while I feel. Feeling for any sort of crunchiness as you rotate around. All right, good. Smells good. Let's try to check your, I'm going to use this tuning fork to check your reflexes here, okay? Let's see how we do. All right, that was a good reflex. Oh, not there. That one was good. You got reflexes. Sweet. Okay. So I want to test some sensation. Go ahead and lay back. Raise your arms up. Put them down. Raise your legs up one at a time. Put them down. Nice. All right. I want you to close your eyes and I want you to tell me where I'm touching you.
My arm.
Okay.
My leg.
Which one?
Left one.
All right. All right. How about this side?
Arm.
All right. And this?
Right leg.
Okay. How about here?
Chin.
Okay. Good. All right. Now, let's see. How about you stand up and let's do the Romberg test. I want you to stand on one leg for 20 seconds and go. Any swaying, any moving, that looks pretty good. Nothing out of the ordinary. Okay, I'd say that's pretty good. Now, one more again, close your eyes. I'm going to put an item in your hand. I want you to tell me what it is. Okay? What do you think that is?
Chapstick.
Chapstick. It is indeed chapstick. All right. I think that's about it. Feel good about that?
Mm-hmm.
I think that was better than the last one. I think I got everything. All right. Thank you. And thank you.